Hi, I'm Dr. Cohen. If you're at this segment of my video, you would be interested in nose surgery. Nose surgery is my favorite operation to do. Every patient's unique, every patient's different, and it is an absolute life-changing procedure for many people. You can really take somebody and alter their appearance in a hugely dramatic way for the positive in a very short amount of time. The surgery virtually is always done under general anesthesia, for the exception of the most minor work at the tip of the nose. I tend to do most of my noses closed versus most doctors, or many doctors, who do open rhinoplasties, which means in English that all of my surgery is done through the nostrils, for the exception of those patients who need reduction of their nostrils, which can be done but not that often. The open rhinoplasties, if necessary, are fine, but if you can avoid the scar at the columella over here, I think it speeds your recovery. It also limits some of the complications associated with rhinoplasty. What are the most common complaints of people's noses? Well, obviously big bumps on the dorsum of their nose, bulbous tips, wide bases of their nose, and wide nostrils. Breathing problems are also commonplace and can be corrected at the same time. A rhinoplasty, it's said, if you can't do under an hour, you shouldn't do it. I think that's true. People get lost in swelling, complications go up, and there's really not much in a rhinoplasty that can't be done in under an hour. Most of my rhinoplasties certainly fit that description. I do virtually all my rhinoplasties as an outpatient. The complications are relatively small. Bleeding is certainly one. Postoperative obstructive nasal breathing can occur, is unusual but easily correctable. Also, patients needing a touch-up, up to 1 in 10 to 1 in 20 patients for minor revisions of cartilage, little bumps, a little rasping to be done at 6 months to a year is something you need to be aware of. The recovery is relatively simple. Most people take only pain medicine for a day or two. Most people wear an external nasal splint on your nose for approximately 5 to 7 days. And for those people who have their septum fixed at the same time to help treat breathing problems, they will have an internal nasal splint in for approximately a week as well. My average patient's back to work at a week, exercising at 2 weeks, and it takes about a year to see the final outcome of all aspects of the nasal surgery, and that is the most difficult thing for people to get through. Your nose will change from swelling for the course of an entire year, and that's particularly true at the area of the tip. So patience is a virtue with a rhinoplasty. They're great operations. When you need it, it can really change your life. It's something that I love to do, something I do fairly well, and it's something that's done as an outpatient, and I strongly urge you to come in and talk to me. This is one of the areas of cosmetic surgery where video imaging can often play a major role in showing you what you're going to look like. So if you come in, we'll take a digital image of you, and we can show you pretty good examples, especially on your profile, of the changes which are reasonable to achieve. Not promises, but educational, reasonable improvements to expect from a rhinoplasty. The surgery, again, takes an hour. It's typically done under general anesthesia. It's done in our HHC Medicare approved surgery center here in our Rockville facility. It can be done under local anesthesia if you're just doing minor tip work, but that's pretty uncommon, and we really feel strongly about making sure that your airway and your breathing is protected during the surgery. The recovery is very straightforward with minimal pain, and I really urge people to look at our website, to look at our pictures, to talk to patients, and I think that if you do your research, you'll find that this is a great place to get your nose fixed if that's something that you're thinking about doing. The last thing is question that comes up is, what's the appropriate age to do noses? Well, many people choose to do their noses as teens, as before they come to full conceptualization or what their idea is of who they are. Some children do it before they get to college, or teenagers before they go off to college and get a whole new grouping of friends. The truth is that girls can do it younger than boys. When they hit secondary sexual characteristics, 12, 13 even is a reasonable age to do it for girls. For boys, it's usually 14 or 15 years old, and it's something that's very well tolerated by teens and adults alike. I encourage you to come on in and talk to me and to send me your pictures. If you send me good digital images, I can even send you back a digitized version of what I think is reasonable. please contact me at the office, and I'm happy to send you my books for free, and I'm happy to answer any questions that you have by contacting me directly. I look forward to meeting you.